Good afternoon, everyone. Throughout the pandemic, the health and safety of Ontarians has remained our government's top priority. And the evidence shows that the best way to protect ourselves and each other is by getting vaccinated. This is especially true when it comes to our most vulnerable, including those living in long-term care. That is why our government has taken many steps to increase vaccination rates for long-term care residents and staff. And with essentially all residents and 86% of staff fully immunized, we've been making good progress. These actions have included providing educational materials and information resources to homes, arranging on-site and mobile vaccine clinics, and providing homes with support so that they can administer vaccines themselves in a timely manner. In addition, Ontario was the first province in Canada to make it mandatory for homes to have an immunization policy in place for staff, students, and volunteers. This policy came into effect on July the 1st. As part of this policy, homes were required to track and report their overall staff immunization rates to the ministry on a monthly basis. When we look at that data, we see that there has been some improvement in staff immunization rates, but it is not enough to ensure residents are protected. We're able to see some wide variations between homes. Currently, 367 of the 626 homes have staff immunization levels below 90%. And more concerningly, 99 homes have a rate below 80%. We want to protect all long-term care residents and all staff, regardless of which home they live or work in. And the evidence shows in long-term care settings, these rates are not acceptable, especially in the context of the Delta variant, which is more transmissible and more likely to lead to serious death or illness. We know that long-term care residents have been disproportionately impacted by COVID-19, and as new variants continue to spread, the risk to those most vulnerable remains high. That is why in August, Ontario was the first jurisdiction in North America to provide third doses to all long-term care residents. And as of today, I'm happy to report that 44,072, or 64% of residents, have received a third dose. All residents are expected to have been offered a third dose by October 8th, which is a week today. However, given the reality of the Delta variant across Canada and around the world, we need to do more. Guaranteeing that those working in the homes for long-term care are vaccinated is the next necessary step to provide residents and staff the greatest level of protection possible. And that is why, after consulting with Dr. Moore, the Chief Medical Officer, this morning, I signed a minister's directive making vaccinations mandatory for all long-term care staff, including support staff, students, and volunteers. Unless a staff member has a medical exemption, they have until November 15th to show proof that they've received 2 doses of COVID-19 vaccine, and staff who don't show this will not be allowed to work inside a long-term care home. At this stage in the pandemic, this measure is essential to protecting residents and staff. Homes will continue to be required to track and report on the implementation of their mandatory vaccination policies and their overall staff immunization rates. And to increase transparency, the Ministry of Long-Term Care is publicly posting staff vaccination rates for Ontario homes beginning this afternoon. This data will be updated monthly. Residents and family members deserve to know the vaccination rates of those that are caring for them. Now, we do understand that this policy may negatively impact staffing at some homes once it comes into force, so we are putting measures in place to support homes that may need some help. And that includes continuing to provide prevention and containment funding to homes so that they can hire new staff as needed, deploying our secure mobile enhancement and support teams to work with homes facing critical staffing shortages. These teams were quite successful and deployed to 70 homes during the previous waves. We are also extending the use of the Specialized Care Centre, which I toured last week, to give surge capacity to long-term care residents across the GTA. In addition, we are expecting 11,000 new PSWs supported by our government's initiatives to graduate in the coming months. Again, these new staff will be available to support the homes. In addition, homes will begin randomized testing of vaccinated staff, and the ministry will be inspecting and auditing these results. We will also step up our rigorous inspections of homes' infection, prevention, and control measures. Before I take questions, I'd like to end by expressing my deep appreciation for all of the staff working in our province's long-term care homes. Over the past several months, I have had the opportunity to visit many homes across the province, and I am truly in awe of the dedication and commitment of our long-term care workers. Thank you for everything that you do, and thank you to the tens of thousands of staff, students, and volunteers who've already gotten vaccinated. If you're one of the staff who's not yet gotten vaccinated, I ask you to please go and book your first shot. Please make the choice to protect yourself, your coworkers, and the residents that depend on you every day. And we'll continue to do what needs to be done to protect our most vulnerable against the spread of COVID-19. Thank you, and I'd be happy to take your questions.
Minister, it's been more than a year since long-term care employees were eligible for the vaccine. You're saying the vaccine in this measure is essential. Why was it not essential in January, February, March, April, May? Why is it essential now and not back then?
You know, Colin, we have been making excellent progress to date, and the vaccination rates for staff in long-term care homes in Ontario is among the highest, if not the highest, across the country. But as we looked at the data that came in, it's one of the reasons that I asked that we have home-by-home data. In addition to the COVAX data we were using before, you could see the variations, and you could simply see that we were not going to get to the level of vaccination that we needed to get to. We're fortunate in Ontario that we have among the lowest community infection rates, and that's great. We are fortunate because of the decisions of this government that we have over 60% of our seniors in homes that have been given a booster dose. But the point at this juncture is that we need to take the next step. So now is an important time to do that. We did it in consultation with the Chief Medical Officer to make sure that we are protecting people as they need to be protected, and we'll continue to take measures that we need to take that are commensurate with the situation.
Can you explain to us why then you're giving those staff a month and a half in order to comply? Ontarians, as an example, we were given from September 1st to September 22nd to get vaccinated, or you couldn't dine indoors. Yet long-term care employees dealing with the most vulnerable Ontarians have a month and a half. Can you explain why?
Well, medically, there's a 4-week requirement in between first and second doses. So that's 4 weeks out of the 6 weeks. And we are, of course, putting this out on Friday, saying by the end of next week, we need people to get their first dose, and then providing an extra week, because in some remote areas of the province, there can be scheduling issues. But be clear, there is enough vaccine available. Many of the homes that are most concerning, Colin, we've had numerous clinics from public health at those homes. So the ability to get a vaccination isn't the issue, but we do recognize that there's a medical requirement that the vaccine suggested to have a 4-week gap in between vaccinations. So that's why the 6 weeks. And obviously, you know, my request to the long-term care workers out there who haven't been vaccinated is please book your appointment right away. Get the vaccination this weekend.
Do you have a question, Mike?
Yeah, Minister, sorry, a slightly different topic. Just looking ahead to Monday with the throne speech, how significant of a reset is it going to be? How significantly different is the direction that the government's going to take? Are we going to hear a different message from the government in the throne speech on Monday?
I think the government consistently has been making sure that people in Ontario are aware of what we've been doing, particularly as relates to protecting the health and safety of Ontarians with COVID-19. And, this is an important opportunity as the legislature comes back, as we are still in this fourth wave with the recent federal election. It's an opportunity for the government to be clear about what is being done and, of course, what the legislative agenda will be for us in the fall. And I don't want to steal the Lieutenant Governor's thunder, so I'm sure she'll speak to that as well.
But is it all going to be COVID related, or are there going to be things that are not to do with the pandemic?
Listen, this government is laser focused on our response to COVID-19, but there are many other issues that come up during the course of governing. So again, it's about making sure that we're being clear, and we can't emphasize this enough, that the people of Ontario know what priorities are, and also what is being done to protect their health and safety.
So we'll go to the phone for questions. Just a reminder, it's one question and one follow-up. First question.
Loris Joan, Globe and Mail.
Hi, Minister. Thanks for taking our questions. I wanted to ask about what happens to staff who don't get vaccinated by November 15th. And your release says will not be able to enter a long-term care home to work. It doesn't say fired. It doesn't say suspended without pay. So does that mean these people will just be reassigned to a desk duty or another duty that doesn't involve direct interaction with residents? And then if that's so, how is that a deterrent, especially if they're making the same salary?
Yeah, so thank you for the question, Laura. Of course, the government of Ontario doesn't directly employ the staff that work in long-term care homes. They work either for a municipality or a not-for-profit or for one of the other organizations that run not-for-profit homes. What we are making clear is that those staff won't be able to be working in a long-term care home. That's where the risk is. Now, I can tell you the reality of working in long-term care, PSWs and nurses, and I've had the chance to visit many of them, is that there aren't a lot of jobs outside of the long-term care facility. So we fully recognize that this is going to be a difficult decision for some of those people. But the priority has to be protecting the safety of the residents and protecting the safety of the other staff. I happen to, in my visits, have been in some of the homes. As you would know, about half of the operators in long-term care have already put in place mandates. And I happen to have been in one of the homes in Hamilton the day the memo arrived about the fact that that particular organization was going to require vaccination. And I have to say it's very well received. Remember, close to 9 out of 10 long-term care staff have already received 2 vaccinations. 9 out of 10 have received, 90% have received 1 vaccine already. So listen, this will be difficult for those who make a choice not to become vaccinated. But the reality is that our residents, they don't have a choice about where they are going to live. This is their home. And we have to make sure that they are protected, and we have to make sure that all of those other staff are protected as well.
Thanks. So just to clarify, it will be up to the individual homes or the municipality that runs the homes to ultimately decide what happens to the staff. And then just on another point on the testing, so the regular testing of residents and staff, what do you expect that would lead to? I mean, we saw certainly during previous waves, 1 or 2 cases had the potential to shut down homes and lock residents in their rooms and suspend activities. Is that, if you discover 3 or 4 cases in a home among fully vaccinated people, is that going to then limit their quality of life yet again and kind of all those freedoms that the government has given back to these residents?
So the randomized testing is an acknowledgement that we do have breakthrough issues. And although a vaccine makes you 8 to 11 times safer and less likely to catch COVID, that doesn't mean that you can't. So this is just another layer of support, another layer of safety that we are putting in place. And you reminded me of something I from speaking to many of the people managing these homes. There is, of course, the risk of losing some staff in some of these homes, and we've put in place things to mitigate that. But I can tell you the operators of these homes are much more concerned about the implication of exactly what you talked about, which is an outbreak in a home. So instead of losing 5 or 6 staff who might not want to get vaccinated in a regular sized home, in a night they can lose 20 or 30 who have to be quarantined because of an outbreak. So from a human resource perspective, we've looked at this closely. This is the better approach. And from a safety perspective, this is the better approach.
Next question.
Lorenda Redikoff, CBC.
Hi there, thank you. So what about, you're mentioning staff, what about visitors and essential caregivers? Why is there no requirement for them?
Right. So when we have someone who is providing care on a daily basis, we'll be looking at them similarly from a staff perspective. But we know that there was a great deal of impact to the fact that visitors couldn't go into homes. And so at this point, of course, any unvaccinated individual would need to be tested going in. Of course, these people are visiting one individual, not multiple individuals typically, so the risk is lower. But none of these steps are off the table in the future. Right now, we're trying to keep that delicate balance. We need to protect our residents. We need to protect our staff. We need to protect the safety of these homes from COVID-19, but we also want to make sure that we maintain the quality of life. So at this stage, we're focusing on staff. Again, the epidemiological reports would indicate that unvaccinated staff are a significant source. And of course, we are not seeing widespread outbreaks here in Ontario, but to the extent we are, when we look at that data, we see that those unvaccinated staff are one of the significant causes. But we'll continue to look at the data and continue to take the steps that are necessary.
And I realize you are the Minister of Long-Term Care, but do you have a sense of what could be coming for retirement homes? Could this also be duplicated there?
You know, as we have throughout the pandemic, we will keep monitoring the data. I know that both Minister Cho and Minister Elliott continue to look at the data that relates to their facilities. As I mentioned, we have seen an increase in outbreaks in long-term care homes, and we know that that's a particularly vulnerable population, so we're taking this step today. But our government will continue to look at what is necessary to protect people. As I mentioned, you know, we are in a good place in Ontario relative certainly to the rest of the country from an infections per 100,000, and I've spoken before about how community spread is the primary risk, and a very good position, much better position than anywhere, frankly, in the United States. But we know that, as Colin pointed out, steps like this take time, and this is a particularly vulnerable population, a population that's been, you know, terribly affected during the course of the pandemic, and we want to make sure that we're putting the protection in place for them now.
Next question.
Jack Howen, Queen's Park Briefing.
Hi, Minister. It's been 5 months since the Long-Term Care Commission's final report, so I was just wondering if we could get an update on the implementation of those recommendations.
So, Jack, we will be bringing forward the details in terms of our plan to fix long-term care. As I think I've mentioned before, I'll be bringing legislation as part of the fall session. That's an important part of that. But we really have 3 areas of focus, very much in response not just to the Commission, but to the many other recommendations, to the conversations that I've had with families, with residents, and with others. We'll be focusing on care, and of course we've made our commitment to expand care, a 45% commitment, a 45% increase in terms of staffing levels and commitment to 4 hours of care. So important initiatives that will take steps forward in the weeks ahead. In terms of building new homes and redeveloping homes, we know that over the 7 years that preceded our election, there were only 611 net new beds built in the whole province. We are on track in terms of 30,000 new beds, 20,000 of those already allocated, and that also involves the redevelopment of beds. So we need those new spaces, and we need them to be built, and that'll be an important focus. But then finally, when it comes to legislation, we will need to make sure, learning from the conversations we've been having, learning from what the Commission told us, learning from what happened during COVID-19, that we have greater enforcement, that we have greater transparency, and that we ensure accountability. So all of those will be 3 important priorities related to our plans, and in executing on those plans, people will see our response, very proactive response to the Commission and others that have given us good advice.
And I was wondering if as part of that plan, getting for-profit companies out of the care side of long-term care will be included in that, as that was also a key recommendation of the Commission.
Well, their recommendation wasn't to eliminate any particular governance structure of or ownership structure of care. It was to make sure that the motives and make sure that the missions of those organizations were in place and appropriate. So, you know, we again will look at all the Commission recommendations, but we have a critical priority, and again, in going out to the various homes I have, you can see that we need more staff. And we'll start to be putting those staff, you know, into those long-term care homes as part of our commitment to 4 hours of care this year, this calendar year. We need to renovate homes. We need to fix the older homes, and we need to build new homes. We still have a unacceptably long waiting list. And we need to make sure that enforcement, accountability, and transparency are part of the culture around long-term care here in Ontario.
Next question.
Rob Ferguson, Toronto Star.
Hi, Minister. I can hear people wondering, and this would go beyond your ministry, but since you're a senior minister and at the cabinet table, I will ask, why not extend mandatory vaccinations to teachers and other healthcare workers like hospital workers?
You know, we are, as always, looking at the most recent scientific data. In the case of long-term care, looking at the data that starting the reporting that we did in July 1st, we have about individual homes, and we'll continue to follow the data in making those decisions. So in the case of long-term care, We have had, as I said, an acceleration in terms of outbreaks. We can see that this is a very vulnerable population that we need to support, and we can see that the source of those outbreaks comes from a very specific place. Not all outbreaks, but that many outbreaks are coming from unvaccinated or partially vaccinated staff. So whether it's in long-term care or the other parts of our responsibilities, we'll continue to watch that trends. We'll continue to watch that data. We'll continue to work with Dr. Moore and his team, and to follow the science to make the best decisions to protect, in this case, residents of long-term care.
All right, thanks for that, Minister. And wondering, just I haven't looked at the list yet, but off the top of your head, can you recall what the lowest vaccination rate was in any nursing homes? How low did it go?
Listen, I want to make sure this is in context of we have had good participation from long-term care staff, but we do have homes that have under 40% vaccination rates. And when I talked about, I should say, home that has under 40% vaccination rate, and when we talk about vaccination rates, as I did, 99 homes that are less than 80%, recognize that 80% is now the average for our province. Clearly, working in a long-term care home comes with a responsibility, and I know that the workers that work there take this very seriously, but a very important responsibility of caring for some vulnerable people. So I know when we release the results, I believe within about an hour, that'll be of interest in terms of the various areas. And I have to say that the ministry's been working with the operators of those homes, but this clearly needs to improve. We need to take this step now.
Next question. This will be the final question.
Alison Jones with the Canadian Press.
Hi, Minister. Just on what you were saying in response to Rob, what is your plan for supporting homes that are going to have serious staffing concerns in the wake of this policy? For example, that home you mentioned that has under 40% vaccination, if they lose, 60+% of their staff overnight, what's going to happen there? How are you going to ensure that these homes have enough staffing to care for residents?
So we will make sure that the homes have enough staffing, but it has been what's occupied us in terms of putting these plans together as we've looked to the potential. I should say, just remind you, as I mentioned before, that the bigger concern for the vast majority of homes who are doing fairly well, as I said, the average for double doses is 86%. 90% of staff have had at least one dose across the sector. But the bigger concern for the vast majority of homes is not the relatively small number of people who may finally decide that they don't want to get vaccinated, but that an infected person with COVID-19 coming in, an unvaccinated staff member, would cause a broader outbreak, and that would actually take dozens of staff out of the home. But we have and understand that there might be specific situations that need support. As I mentioned, the special care center that operates in the West End, which I toured recently, will be staying in place. And we've added additional funding to support that, to make sure it's there to support homes. We have our mobile support teams, which, as I mentioned in the speech, helped with 70 different homes during the course of the pandemic, so should that be required. And very importantly, we have thousands and thousands of brand new PSWs that, as a result of our accelerated training program, where the government paid tuition and paid the other costs, we have thousands of those PSWs coming into the system in the months ahead, certainly in November and December. It'll be 17,000 by March. So we are looking at all of those resources. We're working directly with the homes, but most importantly, and I just take the opportunity again, I just encourage the staff who are not yet vaccinated, who I know take their responsibility for the safety of their residents very, very seriously, to get that vaccination.
And you say the staff have to be vaccinated by November 15th unless they have a medical exemption. What is the ministry going to be considering as a valid medical exemption? Is it what the government has laid out before, the very narrow set of circumstances of having, say, an allergy or an adverse reaction to a first dose, or will any note from any doctor suffice?
So we'll be following the protocol so far, and as some your words, a fairly narrow list of potential issues. Again, we take our advice from the doctors on this in terms of what is an appropriate medical exemption, and again, our objective is to get as close to 100% of the staff vaccinated in these homes. Understanding there are a very small number of people who have legitimate medical exemptions. We want to make sure that we're sensitive to that. But this is about getting to a rate of vaccination in homes where we can keep families, we can keep residents, and we can keep staff safe.
Minister, before you go, long-term care workers or PSWs often, go from long-term care homes to home care. Sometimes they go to hospital. This is, as you said, not a blanket policy here. So how do you prevent a long-term care worker who's barred from entering a home from going to a hospital or from going to home care?
Yeah, so there are many hypotheticals about what could happen. This.
That's how the sector works. I mean, they get their hours from multiple places.
Yeah, most of the long-term care, of course, since we've been having vaccinated long-term care workers, we've been allowing them to work in more than one facility on the vaccinated side. And again, we will continue to monitor. For example, you mentioned home care. If you look against the, for instance, the number of fatalities that happen in the home care sector versus the long-term care sector, it's dramatically different. So we will look and continue to look at the data and see what needs to be done, and again, take the steps that need to be done. But right now, the focus is on the area where the risk could be, and that focus is in long-term care.
But you're saying a long-term care, a PSW, could continue to work as a PSW in home care or a hospital?
This policy applies to long-term care.
So that's a yes.
That's what this policy applies to, yes.
Okay. Thank you.
Great. Thanks, everybody. Appreciate it on a Friday. Thank you.